Welcome to Deuk Spine Institute. I'm Dr. Deuk Majan, CEO and founder. Our patient is here from Canada with back pain that he's had for many years. When you look at the x-ray, we need a little deeper, you can see that he's had fusion done at L3-4, L4-5, and now he's here with adjacent segment disease. That's the problem with spinal fusion, folks. Number one, it's invasive and dangerous, but number two, shot. It is also causes what's called adjacent segment disease. Shot. All right. Adjacent segment disease is basically disease that affects the joints below and above your fusion. Change out the IV. Oh. Any questions?
Yes, we have about 2 questions. This next one is from Becky on Facebook.
Sean? Hi, Becky. Welcome.
Asking, I've had an MRI and the report says that I have a Schmorl's node. What is that?
Yeah, Schmorl's node is basically a place on your bone, the vertebral body, where the disc material has come from the disc space and moved into the bone. It's absolutely unremarkable. It never causes a problem. It's something most of the time people are just born with it, and it never causes any pain or symptoms. So leave it alone. It is totally unimportant. Forget about it. So it's basically a disc herniation up into your vertebral body through the end plate. Totally painless and asymptomatic. We never, ever, ever treat them because they never cause any problems. Shot? It is not causing any symptoms for you. Best to forget about it.
Avi, 2% on Rhizotomy, please. Thank you.
All right. We are doing a facet treatment here for this patient because he has painful facet joints. He has painful facet joints on both sides, L5-S1, below his fusion. Can you guys see the fusion there? It's pretty obvious,
yes, we can.
Right? Yeah. Again, I did not do his fusion. His fusion was done in the past, and it was done by, well, doctors that feel that fusion is necessary. Unfortunately, it didn't work for him. He's in more pain now than ever before, and we don't recommend fusion at Deuk Spine, well, because most of the time fusion is totally unnecessary. Any questions?
Yes, we have a question coming from Nolan on YouTube.
Hi, Nolan.
Asking for a T12 to L1 herniation that is compressing the spinal cord and calcified against the dura. What would you recommend? I have heard if it is pulled away from the dura, you can have a leak.
Yeah. Here's what I recommend, my friend. If that's you're talking about, I recommend you do our free MRI review because that is not causing your symptoms and it does not need to be treated. There's something else going on that's being missed. And I can tell you what it is. If you just do a quick 10-minute Zoom call, I'll tell you exactly what to do. Calcified disc herniations rarely cause symptoms. Rarely, rarely, rarely. I would be very surprised if yours is causing any symptoms. Sean? All right. So, Sean, we're going to be fixing the left L5-S1 facet issue, plus we're going to fix the sacroiliac joint problem here on the left side. Show us the arthritis in the SI joint. Go. Knife. Meanwhile, I'm going to make an incision. It's 4 millimeters. That's all we need is a 4 millimeter incision. Shot.
Right there, please. Thank you.
Did you show them the arthritis? Huh? Okay, shot. Show them again. You guys see the joint right there? No. Move slowly. You see the white line? That's the joint. The white line is the joint. Then you got this dark bone to the left and right of the joint. That's arthritis, thickened bone. It's called sclerotic bone. It's an indication that there's arthritis happening in that joint. All right, shot. We're going to go down and we're going to zap the pain nerve to the left L5-S1 facet joint over here. Shot. It's too low. Shot. Can you show the audience how facet joints cause so much pain?
Of course.
Shot.
For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Shot. All right. You can see that I'm targeting with my probe the medial branch of the dorsal ramus at, that's okay, at L5. Now I'm going to target the dorsal ramus down here right on the top of the sacrum. And these are pain nerves, folks. They're only nerves that cause pain. Shot. They have no other purpose but pain. So somebody much smarter than me a long time ago, shot, figured out, you know, if we just go in and kill these pain nerves, we should be able to get rid of the pain coming from that joint. And sure enough, it worked. And they call that procedure a rhizotomy. Shot? And that's what we're doing. We're doing a rhizotomy. I actually just felt the pain nerve go right there. Shot? Shot? Now I'm going to start targeting the other pain nerves to the SI joint. They're very deep. They run from the foramen lateral to the SI joint. Did we show the audience how we treat sacroiliac joint pain?
We have not.
Let's do that.
Of course.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
And welcome back. We've just finished doing the patient's SI joint rhizotomy on the left. Now we're going to move to his piriformis. So we'll be right back with